Emile, thanks so much for your time on the AM report. Perhaps let's begin here with you telling me about this resilience index. What does it all mean?
Sure. So thank you, Michelle, and good morning. What we wanted to do is to look at our data as it's emerging from COVID. As you know, Discovery is in quite a unique position in the sense that we are getting information about who tested positive for COVID. And then we can see from the data which of those people get admitted to hospital. In addition to that, we obviously have a lot of detail about people's health records because they've been covered by Discovery for many years. So we can look at what factors basically indicate that you are at higher or lower risk of admission as a result of COVID. And even though we don't yet have a large number of admissions, it's just over 400 at this point. And typically you'd want to wait for longer and more data before you fit the model to it, the statistical model. What we thought is that what we could see in the data already is interesting, and we should actually tell people about it. And what we found is that it certainly seems to be the case that as published internationally, the older you are, the higher your risk is. But what we can also see out of the data is the higher your BMI is, the higher your risk is. If you have high blood pressure, hypercholesterolemia, and especially diabetes, you are also at risk. But if you exercise more, then actually your risk is lower.
So a lot of what you're saying isn't new. You've obviously just consolidated what the research has been telling us over the past few weeks, because everything that we know now, we're sort of learning as we go about COVID-19. What does Discovery plan to do with this kind of information?
So what we want to do is to be able to say to people, and we will publish this on our website hopefully within a few weeks, we want to say to them that actually if you just fill in your factors, whatever your body weight is, whatever your age is, whether you suffer from chronic conditions, or if you're a member of Discovery, we can do that for you because we have the data. We can then tell you how much your risk is relative to other people of the same age. But to give you an example, everybody knows that the older you are, the higher your risk of admission is. What we can see from our data is that if you are a 60-year-old that's active, somebody who exercises at age 60, you basically have the same risk as a 40-year-old for COVID admissions. So it's that sort of relativity that we can give to people that gives them, I think, quite useful information. And hopefully it's also motivating for everybody to maintain a healthy lifestyle.
Is Discovery turning down new applications based on any pre-existing conditions related to COVID-19?
No, not for medical insurance. So under South African law, we can't exclude people for new conditions. And this is a prescribed minimum benefit. So the rules around that is a bit complex, but even so, because it's a prescribed minimum benefit, it means that effectively we're covering it.
How is Discovery perhaps changing the way it does business in light of a pandemic?
I'm based in London at the moment, and I can tell you that certainly as I'm sitting here, 3 weeks ago, London was a very strange place, right? Because the streets are empty. It's very different to what it usually is. And also you could hear sirens in the street. So you could hear ambulances actually taking people to hospital. There was a very unusual atmosphere here. So when you talk about 36,000 deaths in the UK, the epidemic has certainly hit very hard here. South Africa was at the same stage of the epidemic. So if you make adjustments for the average age in populations, UK versus South Africa, and we just calculate what the number of deaths would have been if we were at the same stage of the epidemic now, South Africa would have had about close to 11,000 deaths by now, and we're not even close to it. And the simple reason for that is that our government made the very wise choice to go into lockdown much earlier in the epidemic, and that made all the difference. I'll give you another example. In South Korea, on the 20th of January, they had the first confirmed case of COVID-19, 20 January this year. In the United States, the first confirmed case was on 21 January, 1 day later. Yet in South Korea, 263 people have died now, and the United States is almost 95,000 people that have died. And the difference between those is purely government response. It was how quickly the country went into lockdown, how they managed it from that point onwards. So the big question for South Africa going forward is how will we manage it from this point onwards? And it's the same question in the UK. And it's all about government response, the controls that are in place, and also whether people actually comply with those directives. The big question for us is for our life insurance businesses and our health insurance businesses, do we have enough capital and liquidity to pay the claims when they come? Because they will come. Until there's a vaccine, we are exposed to it. And we've certainly worked very hard over the last number of weeks to do stress testing. So we're projecting a whole lot of possible futures. And there's a wide variety of possible scenarios that you can imagine. And then we test. So if we have to pay claims for so many people insured, then do we have enough capital and liquidity? And certainly what we see from our numbers is that we are very resilient from capital liquidity point of view to whatever would happen. So I think we can be very safe and sure in the knowledge that if you are covered if you have one of our products, and if this hits you, then effectively you will be able to get the cover.
What would your advice be to government at the end of May? Every day we're seeing an increase in the number of cases. We're seeing more and more deaths. That situation will no doubt continue in the coming weeks. What's your advice?
I think that the best thing to do is to look at what's happening across the world and to try and learn from other countries' experience and do whatever we can to limit the disease. And I think, as I said, that involves social distancing, contact tracing, trying to isolate whoever comes into contact with COVID-positive people, trying to have safe health and safety in the workplace for the people who go back to work, and for people who remain vulnerable, basically say to them, it's best if you just stay at home and work from home and try and make sure that you isolate and that you don't come into contact with the virus.
Yeah, there are no easy wins. Thank you very much for speaking to us on the AM Report, Emile.